Disclaimer: the parts or the titles will be presented through cutout pictures. The excretory system. The excretory system is responsible for the creation, storage, and elimination of urine. It allows the body to eliminate nitrogenous wastes such as urea and uric acid. It also allows the body to adjust its concentrations of salt by producing dilute or concentrated urine.
There are 4 types of cells in the excretory system. These are 1 pore cell, 1 duct cell, 1 canal cell, and a fused pair of gland cells. The 1 canal cell, also called as the excretory cell, is the largest cell and provides an easily identifiable landmark in embryogenesis. Its cell body lies immediately below the anterior portion of the terminal bulb of the pharynx, adjacent to the ventral epidermal ridge, and forms a bridge between the right and left excretory canals. The excretory gland cell is a binucleate, A-shaped cell that is formed by fusion of 2 identical cells. It has 2 separate cell bodies lying subventrally in the pseudocoelomic space on the left and right sides and just posterior to the pharyngeal intestinal valve. The duct cell is a cuticle-lined channel that connects the excretory system to outside via the excretory pore located at midline on the ventral side of the body. The duct cell surrounds the duct from its origin to the boundary of the pore cell, covering about 2/3. The pore cell, like the duct cell, the pore cell is a specialized transitional epithelial cell. It encloses the ventral third of the duct and forms an adherence junctions with the duct cell at the duct cell-pore cell junction. It also makes junctions with itself by wrapping around the duct.
The organs of excretory system are made up of epithelial tissues, and there are 2 types of epithelial cells, simple and stratified. Simple consists of 1 layer of cells, while stratified consists of more than 1 layer of cells. The main function of epithelial cells is to accommodate changes in volume of the liquid in an organ or tube and protects against the caustic events of the urine. All epithelial tissue rests on a basement membrane, which is a thin protective membrane located on the outside of the tissue. Because simple tissue is only 1 cell thick, every cell in simple tissue comes in direct contact with this basement membrane. Stratified tissue, however, is several layers thick, and therefore has layers that do not come in contact with the basement membrane. There are 3 different cell types found in simple epithelial tissue. This includes squamous, the smallest found cells, cuboidal, which are larger cube-shaped cells, and columnar, which are elongated single cells. Stratified tissue contains cells of varying flatness on different layers. Layers farthest away from the basement membrane tend to be the flattest. The layer that touches the basement membrane will contain either squamous, cuboidal, or columnar cells.
Whereas, the organs that are part of the urinary system are the kidneys, ureters, urinary bladder, and urethra. Now we will discuss each organ that is part of this system.
Next part is the ureter is a muscular duct or tube conveying the urine from a kidney to the bladder or cloaca. Its functions are: 1. It carries urine from kidneys to urinary bladder via peristalsis. It enters the bladder from below. And 3rd, the pressure from full bladder compresses ureters and prevents backflow. The ureter is 25 to 30 centimeters long and has 3 parts: the abdominal ureter, the pelvic ureter, and the intravesical or intramural ureter.
The urinary bladder is a hollow muscular organ located in the lesser pelvis when empty. It serves as a reservoir for urine and can stretch considerably to store close to a maximum of 500 milliliters of urine. Its functions are: 1. It stores urine. 2. Expels urine into the urethra. Parts of the urinary bladder. Apex. Apex is located superiorly, pointing towards the pubic symphysis. It is connected to the umbilicus by the median umbilical ligament. Body. Body. The main part of the bladder located between the apex and the fundus. Fundus. It is located posteriorly. It is triangular shaped with the tip of the triangle pointing backwards. Neck. It is formed by the convergence of the fundus and the two inferolateral surfaces. This structure joins the bladder to the urethra.
The other parts of the excretory system is the skin. The skin performs its excretory function via the sweat glands. These glands produce sweat that contains salt, excess oils, water, and other unnecessary substances which are then excreted out of the body through small pores. Sweating also helps to cool the body during evaporation. Large intestine. The food particles are absorbed into the bloodstream via the small intestine. The undigested substances are transferred to the large intestine, which essentially serves as a storage organ for the excretory products. The descending, ascending, and transverse colons also facilitate the absorption of leftover vitamins, water, and salt. The distal straight section, known as the rectum, is used for the storage of waste products, feces, before they are excreted from the body via the anal canal with the help of internal and external sphincters.
Just to know, fun fact, the main difference between the excretory system of male and female is the length of the urethra.
Yo bro,
Are you in your period? It's like you have blood in your urine, bro.
yeah bro, it's a bit painful and smelly too.
Bro, that's too much detail.
Urethritis is a viral or bacterial infection that causes inflammation of the urethra. Symptoms for urethritis vary between the sexes. Symptoms for men include pain or swelling of the penis, blood in urine or semen, frequent urination, and pain during ejaculation. For women, the symptoms are pain during urination, abdominal pain, fever, chills, frequent urination, vaginal discharge, and pelvis pain. Urethritis is usually treated with antiviral medication or antibiotics. Painkillers are often used to help sufferers combat the symptoms.
Pyelonephritis is a type of urinary tract infection that travels from the urethra or bladder and to the kidneys. This infection occurs when bacteria enter the body to the urinary tract. Symptoms include frequent urination, burning during urination, blood in the urine, pain in the groin, and abdominal pain. Pyelonephritis is usually treated with oral antibiotics, although the antibiotics are sometimes administered intravenously in cases of severe infections. Cystitis. Cystitis is the medical term for inflammation of the bladder and is one of the most common diseases that affects excretory system organs. As the bladder stores urine before it is excreted from the body, bacteria can build up in the bladder and cause cystitis. Urinary tract infection, or is called UTI, is an infection of the urethra or the bladder. The symptoms include abdominal pain, painful or difficult urination, and fever. The best way to avoid UTI is drinking lots and lots of water.
The urethral stricture. The scarring in and around the urethra is called the urethral stricture. It blocks the passageway of urine as it goes outside. The disease is more prevalent in women compared than men. This can be caused by infection of the urinary tract and injuries due to pelvic fracture. Its symptoms are pain when urinating, reduction in urine flow. Third is urine retention in bladder, and more required time for urination. The feeling of never emptying your bladder and blood in urine. The treatment is dilation of stricture, a process of cutting and removing the stricture with a laser therapy. That is when the area is quickly affected. The treatment after removing the stricture is the reconstruction of the affected area in a not so severe case. The area is allowing to be healed by the natural process. The healing may take some days, and during this time, painkillers and antibiotics may have to be used. The vesicorteral reflux. It is said to occur when the urine flows back from the bladder into ureters. Seen commonly in children, the advance in age sees the reduction in the disease. The main reason of the disease is the defective valve between the uterus and the bladder. The defect may also be present before the birth. A secondary cause is the blockage in the urinary system or malfunctioning of the urinary system. Its symptoms are pain and burning sensation while urinating, pain in the abdomen, increased frequency of urination with very small quantities every time, frequent urge to urinate, and fever. The possible treatments for vesicorteral reflux are the malfunctioning valve between the uterus and the bladder is repaired with surgery in case an infection of the urinary tract is the cause of disease. It can be effectively treated with medicines. The medication is also effective in preventing the infection down to the kidneys. Surgical treatment is also required if the medicines are not effective. When you eat too much salt, beware for kidney stones. Avoid those salty foods.
Bladder cancer. When there is uncontrolled growth of cells present in the bladder, it is known as bladder cancer. The end result is a tumor in the bladder. The cause and effect in case of cancer is not yet very clear, but a number of reasons are cited for this purpose, and most of them are smoking, radiation, parasitic infection, exposure to chemicals known as carcinogens. Its symptoms are pain while urinating, back pain, pain in pelvic region, frequent urge for urination without actual flow or frequent urination, and blood in the urine. The treatment of cancer bladder is similar to the other cancers of the body. It is what we call intravesical therapy, radiation therapy, or chemotherapy is applied coterminous with the surgery. The exact sequence is best determined by the opinion of the treatment, and there is no definite line of standard treatment developed in any countries anywhere in the world.
Now let's talk about the organ transplant in the societal level. We see that the state has already created a law and has amended it last 2015. It's called the Republic Act 7170, or the Law on Organ Transplant, because we see that the state has already deemed it necessary for the people to get their organs donated. Because we see that it's already become essential for people to be donated. Because see, in the excretory system, a lot of organs can actually be made available to people. Now why so is that the black market has already been selling for years, and that is why the state can now have to regulate. Now, what are the implications when the state did this, right? First, it said that they we now have consent with both parties, and they have both knowledge and consent that they wanted to do this in the first place, and that consent is so important with the right of choice, and that it serves as a safety net for people especially who want to get their organs donated after they die to help another human being.
As explained by the past representative about organ donation, the church does not oppose the law of organ donation. They somehow gain momentous advantages towards it. For a donor, they quickly decided that if it does not endanger the life of the donor, it will be accepted by the Catholic Church. And as long as artificial reproduction will not happen, they somehow accept it by the way in the laws are represented. In organ donation after death, as they said by the CCP, is a noble and meritorious act and is to be encouraged as a expression of generous solidarity. As explained by 200 of John Paul in his statements, organ donation can be a way of nurturing a culture of life, preserving all of humanity, all of the race. And number 30 of the law of CCP, the transplantation of organs from living donors is morally permissible when such a donation will not sacrifice or seriously impair the donation to the donor to the receiver.
Ways to keep your excretory system healthy. Think of your excretory system as the hotel housekeepers of your body. Your liver, skin, lungs, kidneys, and other excretory organs work as a team to seek out and sweep out toxins and impurities that muddy up your bloody system. If you trash your hotel room, it makes housekeeping a longer, more exhaustive process, and the same is true of your body. Eating healthy foods, drinking plenty of fluids, getting regular exercise, and avoiding toxins are just a few things you can do to make things easier on your body's cleaners. First is drink water. Water has a dual role in the detox process. First, it flushes your body system, removing toxins and carrying them out of the body. Second, it helps deliver the nutrients your cell needs to perform all functions, including detox, according to the Mayo Clinic. If you are not constantly replenishing your body's water supply, your body reserves its water for its most essential functions. Drinking 8 glasses of water each day to keep your excretory system nourished and functioning properly.
Your skin is an important part of the excretory system. One of the ways your body excretes toxins is through sweat. When you exercise, you sweat more and you also need more water. Sweat is made up of some of the processes of respiration, such as dead cells, according to the Franklin Institute. Exercise also provides a fresh, highly oxygenated blood supply to the major organs of the excretory system. Aim to get to 30 to 60 minutes of exercise 3 to 5 times a week.
Eat a healthy diet. Like all systems of the body, your excretory system needs a plentiful supply of vitamins, minerals, and energy to regulate kidney and liver function and keep all systems working properly. This is best accomplished by eating a variety of nutrient-dense foods. Fruits, vegetables, legumes, and whole grains are some of the most nutrient-rich foods you can give your body. Lean proteins and low-fat dairy can also provide essential nutrients to your diet. Avoid fast food, processed foods, junk food, and empty calories to keep your excretory system working as it should. Aside from being less nutrient-dense, these foods typically contain additives and preservatives that your excretory system has to work hard to process.
We should also avoid toxins. The more toxins you ingest, the bigger the workload your excretory system has to handle. There are some parts of even healthy foods that the body cannot process and some byproducts of bodily function that occur naturally. Then, there are also additional elements of waste your system must process. Some ways to avoid these excess toxins are to avoid drugs, alcohol, and smoking. We should always be conscious of the lotions and body care products that we are using.
Kidney disease is the 8th leading cause of death in the United States. An estimated 31 million people in the United States have chronic kidney disease, also known as CKD. Patients with CKD have two treatment options, a kidney transplant or dialysis. However, there are more than 90,000 people on the waiting list per year for a kidney transplant, so the chances of an individual receiving a transplant are very slim. Under those circumstances, most CKD patients must receive dialysis. There are two types of dialysis, hemodialysis and peritoneal dialysis. But what is hemodialysis?
Hemodialysis is one kind of dialysis which usually is performed in a center. And hemo means blood, so it's blood dialysis. A small amount of your blood is taken out of your body at one time and put through a filter and cleaned and put back in. And that's done over and over a period of 3 to 4 hours, usually 3 times a week. In order to get the blood, you have to have a way to access the bloodstream. And the most common way that's done is something in your arm under the skin, either something called a fistula.
And it does require placing needles into this access. 2 needles are required, one to take the blood out of the body so that it goes through the machine and through the filter, and then a needle to return the blood to the body after it's been cleansed.
With that in mind, what is peritoneal dialysis?
We have a membrane called the peritoneal membrane. It is a lining of our abdominal cavity, and fortunately we can use that peritoneal membrane as a filter.
And the peritoneal dialysis is where you have a catheter in your abdominal cavity and where you do something called an exchange, where you put some fluid in your belly, let it dwell for a little bit, and then you drain it out. And as you drain it out, that takes out all the waste products and some fluid along with it.
Well, there's 2 choices for peritoneal dialysis. There is the manual bag, in which you do an exchange 4 times a day, and then there is the night cycler method, of which when you're ready to go to bed, you hook up to the night cycler, and it does these exchanges for you automatically.
Although dialysis is not painful, patients endure these scars of needles entering their arms or abdomen as they must return for treatment at least 3 times per week. CKD significantly changes the lifestyle of those who have fallen victim to this disease. Patients must change their previous eating habits and be placed on a strict diet. Patients must also implement specific medication into their lives in order to function properly throughout their day.
One, two, three. We should always take care of our excretory system.